Welcome back to Toledo Clinic TV. Our guest for this segment is an interventional cardiologist, Dr. Ahed Nahhas. Tell me exactly what is a interventional cardiologist?
It's a subspecialty of cardiology that specializes in intervention on fixing blocked arteries for the most part in the heart. That's really the typical training. For me, I do that. I also do peripheral work with revascularization percutaneously of the legs, circulation, kidney circulation, carotid arteries, subclavian, so other vascular territories that cause symptoms. That's what I do as well. That's the bulk of my work.
Let's talk about varicose veins. For most people, they're just unsightly. They don't like what they look like, especially on their legs, but they can be very dangerous.
That's very true. Actually, the varicose veins are the tip of the iceberg. And people who have varicose veins, minority of them have just bad-looking small veins, but most of them have symptoms. And those symptoms could vary anywhere from swelling of the legs, like edema, hyperpigmentation, those brownish legs that you see sometimes in some people. Also, you see big bulging varicosities that people hide, they don't want to see. People develop fatigue, leg aching as they stand, as the day goes by. They feel the legs are heavy. Some of them have restless leg syndrome or restless legs at night. Sometimes burning sensations. I've treated patients who were treated by their neurologist because of burning. They were diagnosed or misdiagnosed with neuralgia or neuropathy. After fixing their veins, they didn't have to take those medications anymore. And extensive disease could really lead to ulcer, venous ulcer, that causes oozing of liquid and fluid from the inside of the leg. And obviously that's as worse as can get. And those things are treatable and with a great result.
Do they all need to be treated? I mean, let's say that you have small spider veins on your legs. Is that worth seeing a doctor for?
Well, it depends. If you have symptoms, yes. If you don't have symptoms, most of the time it's, look, these are the symptoms I just mentioned. But, spider veins are the lightest form of venous insufficiency or varicose veins. So if they're minor, they are just for looks. I don't treat them usually, even though I can treat them. My work is mainly for symptomatic and medically needed treatment of varicose veins and venous insufficiency. That's the other term for it. There's about 40 million people in the United States have venous insufficiency. It's an underdiagnosed or overlooked problem. Most people say, oh, okay, just raise your legs or do something. But there's really effective treatment that is done in the office. Extremely simple and without IVs, no sedation, no anesthesia. People come walking, leave walking. It's fascinating. It's just, I'm very intrigued and very impressed with how well and how much improvement you see with simple treatment. That takes usually an hour.
Can you explain what that treatment involves?
Yeah, we have first to confirm that the patient has venous reflux disease, and that's done by ultrasound test on the legs. If they are found to have the disease that involves superficial veins that usually cause those bulging varicosities and the swelling and the itching and the leg ache, then we have to commit them to do 3 months of conservative treatment. That's required by their insurance rules and so forth, even though in many other countries that is not a requirement. Here we're a little bit behind on that. So after 3 months of leg elevation exercise and attempted weight loss and compression stocking, that also is part of the conservative treatment, if they come back and say, yeah, I feel better, but this is not the life I want to live with compression stocking all the time, then we can have a request to treat, and we usually get that request granted. So the first treatment for the most of them would be with radiofrequency ablation, which is basically putting a catheter through the superficial vein, start below the knee or mid-calf or above the knee, depends on the situation. That catheter is advanced up to where the hip is under ultrasound guidance. Then we inject fluid that has numbing medicine and a little bit of saline with it around the catheter. So the catheter is surrounded by a milieu of fluid, and then radiofrequency energy is applied, and the catheter tip is 7-centimeter coil that is heated to 120 degrees Celsius. What that does, because now the vein is collapsed on the catheter, we see it with ultrasound. When you apply thermal energy with radiofrequency, that vein really is destroyed internally in the leg. We do segmental ablation, 1 segment at a time with ultrasound guidance, so you really see what you're doing, and it's extremely safe. And the whole session, when the catheter is in position to closing the vein, it takes about 35 minutes, half an hour, 35 minutes, and you confirm everything with ultrasound. After that, the leg is wrapped, patient ambulates for half an hour in the office, then goes home to have a follow-up ultrasound in 2 days. And then some residual veins, that's those very tortuous veins you see, we cannot get a catheter through them because of the tortuosity. These are treated by minor surgery called microflebectomy. Again, done in the office with minimal sedation like Valium, 5 milligram. And we inject the same fluid that has numbing medicine around those veins, then make tiny nicks in the skin, 2 millimeter, which is extremely tiny and small, like the head of a pencil, 2-3 heads of pencil lined up, that is about 2 millimeter. Then with a special hooks, we hook the vein and pull the vein out. These are for the tortuous ones. And what is left at the spider or telangiectasia that are caused by the big reflux, they could be injected with sclerotherapy. And this really completes everything. So most of people require 1 session if that main vein with radiofrequency takes care of everything. Some of them require 2, rarely 3. And after that, they don't need to wear compression stocking long term. They usually have to do that for 1 to 2 weeks after treatment, and that's it.
So that's done in the office.
In the office, no IVs.
You're numbing them as you go, right? So
Exactly.
there's no pain involved.
No.
It's a very simple procedure.
Extremely simple, and we have music also on.
Fantastic. All right. Thank you so much.
Yeah, thank you.
We'll be right back.